Hello everybody. Social casework practice is essentially based on the understanding of each individual or client personally. An adequate knowledge of the caseworker about the interplay of social and psychological factors that influence the person or the client is very essential. An analytical understanding of the interaction between the inner and outer forces which influence the person makes the process of assessment accurate and therapeutic. And this understanding of the psychodynamics and the pathological symptoms of the personality of the person helps the caseworker to plan the appropriate interventions which will alleviate the distress of the person and increase his or her adaptive skills. Social therapy and psychotherapy are the two broad classifications of social casework interventions. In this context, it is relevant to talk about the therapeutic approaches that are helpful in such interventions. I am now going to talk about the psychoanalytic approach. At the end of this talk, you will be able to understand the basic assumptions of the psychoanalytic approach, to know the different aspects of Freudian theory, to gain an insight into the relevance of psychoanalytic theory in social casework practice. Sigmund Freud is a founder of psychoanalytic theory. As per this theory, events that happen to persons during childhood can contribute to the way they function later as adults. Freud believed that the mind is made of the conscious mind, pre-conscious mind, and the unconscious mind. Psychoanalytical theory focuses on the factors at the unconscious state which influence behavior. It is believed that the experiences or events of the first 6 years of life determine the development of a person's personality, which becomes manifest in adult life. Hence, much attention is paid to such experiences. The original so-called talking therapy involves analyzing the root causes of behavior and feelings by exploring the unconscious mind and the conscious mind's relation to it. Freud considers human nature as basically deterministic. Our behavior is determined by irrational forces, unconscious motivations, biological and instinctual drives as these evolve through key psychosexual stages in the first 6 years of life. Freud added that human nature is dynamic as he believed in the transformation and exchange of energy within the personality. Of course, a person can liberate himself or herself from the determinants once the unconscious becomes conscious and blind habits are replaced by choice. For Freud, human nature could be explained in terms of a conscious mind, a pre-conscious mind, and an unconscious mind. Conscious. According to Freudian understanding, thoughts or motives that a person is currently aware of or is remembering. Pre-conscious refers to thoughts or motives that one can become aware of easily. Unconscious refers to thoughts or motives that lie beyond a person's normal awareness, but that can be made available through psychoanalysis. It stores up all experiences, memories, and repressed materials. Psychoanalytic therapy aims at making the unconscious motives conscious in order to exercise choice. Freud uses a metaphor of an iceberg as an analogy to the unconscious. According to him, 10% of an iceberg is visible, that is conscious. 90% is beneath the water, that is preconscious and unconscious, wherein the unconscious is allotted an overwhelming 75 to 80%. According to the Freudian theory, human personality consists of three parts, namely id, ego, and superego. Let me briefly describe these three parts. Id is the original system of personality with which a person is born and is a primary source of psychic energy and the seat of the instincts known as eros. The id and the superego are confined to the unconscious. The ego operates primarily in the conscious, but also in the preconscious and unconscious. The personality of the newborn child is all id, and only later does it develop an ego and superego. The id does not think, but wishes or acts. It demands immediate satisfaction, and when this happens, a person experiences pleasure, and when it is denied, he or she experiences displeasure or pain. It is illogical, amoral, and driven to satisfy instinctual drives. The id operates through drives, instincts, and images such as dreaming, hallucinating, and fantasizing, a thought process known as primary process. If the id is empowered and left on its own, it would probably destroy a person or cause trouble by acting on the primitive, aggressive, and sexual drives it harbors. The id contains basic life energy, collectively known as eros, and basic death instincts known as thanatos. At first, Freud associated eros with the sexuality, but later he modified this idea, describing all life-preserving instincts as eros and the psychic energy that accompanies them as libido. Any acts of aggression as well as foolishly dangerous behaviors such as taking unnecessary risks were displays of thanatos. The ego is considered as a police or executive. It has contact with the external world of reality, the executive who controls and regulates the personality, the executive who mediates between instincts and the environment, and the executive who controls consciousness and exercises censorship ruled by the reality principle. The superego is a judge of human personality, ruled by moral principle, judicial branch of personality. The main concern of superego is whether something is good or bad, right or wrong. It represents the ideal. It functions to inhibit the id and to persuade the ego and strive for perfectionism. It acts as a parent and society in relation to rewards and punishments. Rewards create feelings of pride and self-love. Punishments create feelings of guilt and inferiority. According to Freudian theory, there is an association between anxiety and defensive mechanisms. Let me first define anxiety. Anxiety is a state of mind characterized by strong feelings of tension, disturbing thoughts, and physical changes such as fluctuating blood pressure, sleeplessness, headache, loss of appetite, and so on. This state of mind affects the individual's thoughts and feelings and behavior. Anxiety emerges due to a conflict among the three, the id, the ego, and the superego, over the control of the psychic energy. It is said that there are three types of anxiety. 1. Reality anxiety. It is a fear of danger from the external world and is proportionate to the degree of real threat. 2. Neurotic anxiety. It is a fear that the instincts of a person will get out of hand and make the person do things for which he or she will be punished. 3. Moral anxiety. It is the fear of one's own conscience. When the ego is not in a position to control anxiety by rational and direct methods, it takes to unrealistic methods, and these methods are known as defense mechanisms. A person makes use of defense mechanisms to cope with anxiety. It is to be noted that defense mechanisms are not exactly pathological, but they have an adaptive value if they do not become a way of life and do not prevent a person to face a reality. Ego defenses operate on an unconscious level and tend to deny or distort reality. The following two characteristics are common to all the defense mechanisms. 1. Denying, falsifying, and distorting reality. 2. Operating unconsciously. Let me mention some of the common defense mechanisms. Repression. This is one of the earliest concepts of psychoanalysis and the basis of many other ego defenses and neurotic disorders. Repression is an involuntary removal of anxiety-provoking memories from our consciousness. However, these memories do not just disappear, and they continue to influence one's behavior. For example, a person who has repressed memories of sexual abuse as an adolescent may later find it difficult to enter into intimate relationships. Denial. This mechanism also operates like repression, but at preconscious and conscious levels. It is the simplest form of self-defense. Denial is very evident in the dynamics of death and grief. For example, when a person is diagnosed as having terminal cancer, he or she, after the initial shock, tends to deny the reality of cancer by saying the doctor may have wrongly diagnosed. Reaction formation. It is a replacement in consciousness of an anxiety-producing feeling by its opposite. Usually, extreme forms of behavior of any kind signify a reaction formation. For example, a person who hates another person cannot accept the painful fact of hating and so expresses extraordinary affection towards that person. Projection. Projection is a mechanism that helps to convert neurotic or moral anxiety into an objective fear. It is used especially when a person feels uneasy with his or her own thoughts because he or she considers those thoughts unacceptable to express and misattribute those thoughts to another person who actually does not have those thoughts. For example, a spouse may get angry with a partner for not listening, when actually it is the angry spouse who does not listen. Projection is often the outcome of one's inability to own up one's motivations and feelings, and it reduces anxiety by substituting a greater danger with a lesser one. Displacement. When a person cannot express his or her feelings directly to an intended person or object because of the inherent danger, he or she resorts to the displacement mechanism by redirecting the feelings to another person. Human beings often make use of this mechanism when they cannot give vent to their feelings in a safe manner to the person whom they have in their mind. For example, a woman who cannot express her anger to her spouse for fear of being beaten up by him may take out her anger at her child. Fixation and regression. Every person goes through different stages of development before reaching maturity. The passage from one stage to another entails certain amount of frustration and anxiety. When this passing becomes too difficult, the process of normal growth may halt, and the person may therefore get fixated at one stage. Thus, when a person gets fixated at an earlier stage in the face of unacceptable thoughts and impulses, this reversion is known as regression. For example, an adolescent who is weighed down by feelings of fear, anger, and guilt through growing sexual impulses may feel safe by reverting to an earlier childhood stage and start exhibiting childhood behavior such as bedwetting. An adult who is under a great deal of stress may not like to get up from bed and carry on normal life, but feel comfortable by staying in bed for longer duration as he or she did as a child. Assertiveness. This is one of the mature defense mechanisms that helps a person to strike a balance between being aggressive and submissive in his or her interactions with others. Assertiveness reflects a person's thoughts and feelings in a respectable and acceptable manner. People who are aggressive tend to get things done the way they want, but in the process, they may not be empathetic and understanding. People who are submissive remain passive and rarely speak up for themselves. Hence, their needs may not be fulfilled and they may feel low and anxious in their relationships. By becoming assertive, a person is able to communicate his or her thoughts directly and firmly, and while doing so, the person can empathetically listen to others. Defense mechanisms are most often learned behaviors, particularly during one's childhood. As an adult, a person can choose to learn some new behavior and new defense mechanism that may be helpful. By being aware of the type of mechanism one resorts to, a person can choose to modify his behavior and reduce his or her level of anxiety also. Freud describes 5 developmental periods during which particular kind of pleasures must be gratified if personality development is to proceed normally. The first stage is oral stage. This period is the first 1.5 years during which sucking at the breast of the mother satisfies the need for food and pleasure for the child. The erogenous zone is a mouth. When the sucking and biting need is not adequately met, then the individual will have feelings of greediness and acquisitiveness and suffer from personality problems of mistrust of others, rejecting the love of others, and fear of entering into intimate relationship. Adults exhibiting behavior of sarcasm, hostility, aggression, gossip, and making bitter comments are related to this period of inadequate fulfillment of oral pleasure. The second stage is the anal stage. This stage takes place from the 18th month to 36 months of a child. The child receives satisfaction by having and retaining bowel movements. The erogenous zone is the anus. Fixation results in retentive or explosive personality. Anal retentive personality is characterized by highly controlled and compulsively neat type. Anal explosive personality is messy, disorderly, rebellious, and destructive. The third stage is phallic stage, which develops between 3 and 6 years. The center of pleasure is the genitals, typically a time of exploration of pleasure through masturbation. The child resolves the Oedipus complex, the period of conflict during the phallic stage when children are sexually attracted to the opposite sex parent and hostile towards the same sex parent. This period is also marked by the castration anxiety in males and penis envy in girls, though this concept was later discredited by Karen Horney. The attitude of parents towards the emerging sexuality of their children at this stage has some bearing on the formation of sexual attitudes and feelings of the children. Threatening or punishing the child has an adverse effect on the adult sex life later. The next stage is the latency stage. This happens between 6 and 12 years. This is a dormant period during which the child begins to socialize and turns its attention outward in order to form relationships. At this time, there is little manifest interest in sexuality. The sexual interest that just emerged previously will be replaced by interest in a wide variety of activities in school and neighborhood, such as games and sports. His or her energy is focused on peer activities and personal mastery of cognitive learning and physical skills. The next stage is the genital stage. This stage of development begins around the age of 12 years. The adolescent develops interest in the opposite sex, desires for sexual experimentations, and assumes adult role and responsibilities. This is the last of the psychosexual phases that occurs around puberty and lasts till old age. If all has gone well previously, each gender takes more interest in the other, and normal heterosexual patterns of interaction appear. The basic components of psychoanalytic theory portray the principal idea that behavior of an adult person is influenced by things that happen during his or her childhood. As Freud believed, the unconscious mind often prompts an individual to make certain decisions, and he or she may not recognize it at the conscious level. Let me now outline the 4 stages of psychoanalytic therapy. The initial stage. The caseworker or the therapist should learn about the problems that the clients need to solve. He or she determines the suitability of psychoanalytic therapy. He or she makes agreement on the counseling principles, stages, and mutual obligations. Then he or she gradually learns about the cause and symptoms of the client. The second stage is a transference stage. As a therapeutic process develops, the client would transfer his or her feelings for a significant person in the childhood to the therapist. According to the transference, the therapist could experience and better understand the feelings of the client. The next stage is the consolidation stage. After learning about the transference and other information of the client, the therapist would make explanations and reveal the relationship between the inner unconscious conflicts or desires and the problem. In this way, the therapist leads the person to realize and comprehend. During this process, there are continuous resistances which are useful to the process of intervention and have good effects. The fourth one is the resolution stage. After consolidating the client's unconscious conflicts or desires, the caseworker or the therapist can set the time for the end of intervention. However, in this period, the transference may repeat many times, so the therapist should reveal some unresolved problems through explanations and make the client face the reality. When the client can solve the transference by himself or herself, the intervention can be terminated. Let me sum up. A comprehensive understanding of psychoanalytical therapy is necessary in helping persons to identify their problems and to solve them. The basic assumption of psychoanalytical theory is that things that happen to persons during childhood can contribute to the way they function later as adults. For Freud, human nature could be explained in terms of a conscious mind, a preconscious mind, and an unconscious mind. According to Freud, the personality consists of three parts: id, ego, and superego. Freud describes 5 developmental periods during which particular kind of pleasures must be gratified if personality development is to proceed normally. Anxiety emerges due to a conflict among the three, id, ego, and superego, over the control of the psychic energy. When the ego is not in a position to control anxiety by rational and direct methods, it takes to unrealistic methods, and these methods are known as defense mechanisms. There are 4 stages in psychoanalytical approach in the process of intervention while working with individuals in problem solving. Let me sign off here and hope to meet you in another session. Thank you.